think she just joined. We're going to be doing it with Lizzie Simon. And she had both the Pectus Excavatum, I believe I'm saying that right, which is basically when your chest bone is indented. The opposite of that, Pectus carinatum, maybe. Pigeon chest. So you're, instead of going sunken in, it's out and it looks like a pigeon chest. So the procedure that she had was called a noose. Again, I don't know if I'm saying this properly or not, but she will know this once she gets added here. It looks like, Lizzie, I see that you're on. You should be able to request to join the, wants to be in your video. Okay, cool. Worked.
There we go.
Yes! Hey, I had a lot harder time with this last time I tried to do it.
There we go.
So I was trying, I don't even know if I'm saying this stuff right. Pectus excavatum, is that right? Okay.
Yeah.
So, and then, do you know the other one where it's pigeon chest? Is it Pectus?
Carnium, I think. How do I
Sure.
say it?
Yeah, I was like,
Yeah.
I don't know how to say any of this.
Yeah.
So I think we have no viewers, but we'll have later.
Yeah.
We didn't get any questions, but like I said, I'm a big nerd, so I wrote down a bunch of mine.
Yeah.
And I also went on Google because I know how much Google is wrong. So I wanted to, like,
Yeah.
after you go through yours, see like what the differences in actual real world stuff is. So, are you there? Oh, okay. There you are.
There we go.
Okay. So,
Okay.
you want to just start off with, when were you diagnosed with Marfan's and when were you diagnosed with the excavatum?
I was diagnosed with Marfan around 6, so they thought that I was just like tall and just everything. Like,
Yeah.
after my growth rate kind of referred me to a cardiologist, and then he was like, yeah, without a doubt, she definitely has it. So I never really got officially tested, but a big diagnosis since I was around 6. And then with the Excavatum, it just kind of developed over time. So as I grew faster and faster, my chest bone just kind of never like fully formed outwards. And then they were always told me it would be more of a cosmetical reason.
Where's Mama?
Steve.
Where's Mama?
Back. Sorry.
It's okay.
They always thought it was more of just like a cosmetic reason to do surgery, so they never like really did anything with it. And then I went up to the Cleveland Clinic, and they were like, no, we should definitely do something with this right now.
Yeah. And when was that?
That was earlier last year. So everything kind of started like moving just really, really fast. Like they finally like put a diagnosis on it, and then they said, okay, well, we'll do some x-rays. And then when they ran the x-rays, they were like, yeah, there's like, I think it was like 19 millimeters between my spinal cord and my sternum. So they were like, yeah, we should probably get it done now until like, yeah. So they try to do it like as you're a teenager because your bones aren't fully developed yet. So, but they're like kind of in that stage where they can still be like manipulated easier and they heal like a lot quicker, but they
So
still have
how
like
old
time.
were you when they decided they wanted to do something about it?
I was 15. Yeah, I
15.
just turned 15 last March. Or no, I was 14 then. So I was 14 when I had the surgery done.
Okay, so you were still in the growth spurt section of your life.
Yeah.
Okay. So did you have any complications? Like, because I know you said 19 millimeters, did you have
Mhm.
like a problems with your lungs or your chest or anything there in your chest?
Yeah, I did. My lung expansion was well below normal.
Mm-hmm.
Um, I was probably, I think it was around 50-ish, I think.
Wow.
So I didn't have much lung expansion at all. And my heart and everything was completely like flipped, and instead of being on my left side of my chest, it was like almost on the right. And we think because of the Marfan actually in my connective tissue being really like squishy and like really easily moved is the reason why my heart wasn't like smashed. So,
Yeah, yeah, probably.
yeah,
One of those good things that are very rare from us.
yeah.
So, did you have asthma or anything like before they said, okay, yeah, it's excavatum?
Um, Not really. I always had like issues breathing and stuff like that. Like it wasn't like considered like asthmatic or anything. It
Hmm.
was I forget the like term that they used for it, but it was basically like COPD in adolescence.
Yeah,
I
yeah.
forget like the correct term, but yeah.
Interesting. Okay. So, when you say you went to Cleveland Clinic to have the procedure,
Yeah.
is that like the leading place around here or?
Um in my eyes, yes, they like were on it the entire time. Like there were basically no complications during surgery and like leading up to it. Like they were super like cool about everything and like really like informed me and my mom and my family on like what was gonna happen and like
Mhm.
how they were gonna proceed with everything.
Okay. So, if they didn't fix it, would it have gotten worse over time?
Um, yes, as I continued growing, I think it would have.
Okay. So, does that have any effect? Like, do you have scoliosis or anything like that?
Yeah.
So, did that
Um,
make it worse or?
I'm not completely sure. I don't think it did because like it just kind of like it brought my posture like very like inward, so like instead of like sitting with my shoulders back a lot, I would hunch over.
Mhm.
It like just brought everything in, but like after surgery, like I could already tell like almost like immediately after surgery I could tell that I was getting like better lung expansion and like I was sitting up a lot straighter.
Yeah. So, okay, do you have your before and after pictures there?
I do not.
Okay. Well, for anybody watching that doesn't know what it is, it's caved in, and there's different degrees of it being caved in. I've seen very, very slight, and yours was probably a large, like it was
Yeah.
scooped out, right?
Yeah.
Okay.
Yeah. I have like stories like me and my like other like patients with Marfan that also had Pectus Excavatum. Like one of my before pictures, like right before I had surgery, like I was able to pour a bowl of cereal in it. It was so deep. Like it like held like liquids like and didn't like spill over or spill out. It was so deep.
Oh my goodness. So was there a problem like with your clothes fitting differently?
Yeah, actually like as like a girl like bras and like bathing suits always fit differently. Like it was just like one of those things like where it was kind of like a self-confidence issue, but it was also more like it's not fitting right. Like, and you could tell like if I wore really loose fitting shirts that if I like was sitting that you could like tell like it folded inwards on my chest.
Wow. So before you had your surgery, was there any pain associated with that at all?
Um, Mostly just the breathing issues. Like I would get short of breath easily and like mostly stuff like that. And I noticed a lot more like chest pain because like I was diagnosed with blebs, like where your like the outer layer of your lungs sticks to your like rib cage,
Oh,
and those were really painful. But like after surgery, I've noticed a lot less.
okay.
So
So you probably were just used to it and you didn't know it.
yeah,
Huh.
pretty much.
Okay. Well, so problems it caused for you was both heart and lung related, right?
Yeah.
So depending on how bad your spine and your cup, let's say, is, I guess it could change per person like everything else.
Yeah.
Okay. What specialists did you see before you had the surgery?
I saw Dr. DeRoss up at Cleveland Clinic, Anthony DeRoss. He was awesome. I never met with the other surgeon that I had, so I don't really know his name, but there were two surgeons during surgery. And um, I also met with different uh, breathing specialists before. So like they ran a lot of tests to see like what my lung function was before surgery, and we have yet to do the one after, but we have one coming up at some point.
Okay. So was it your PCP here that referred you to Cleveland Clinic?
Um, no, it was kind of just my mom put everything in motion. Like, it was one of those things where, like, we talked with my cardiologist. I see Dr. Zaka up at Cleveland Clinic too, and he referred us, like, my mom really pushed for it, and he referred us to Dr. Duras.
Sadly, that's pretty much how you have to get stuff done. You have to be your own
Yeah,
advocate, and
yeah.
where you're underage, it's mom's
Hmm.
job. Which I mean, I know my mom went through all kinds of crap. Because I had before I was 18, I had 4 eye surgeries, 5 gum
Yeah.
surgeries. So I mean, yeah, I can't imagine being a mom and having to go through that on the other side because it's bad
Oh,
enough on
yeah.
our side. So, okay, when you went in to Cleveland Clinic, what
Hmm.
did they tell you, like, what you should expect for like time in the hospital and things like that?
Um, they told me basically, I had to do my pre-op at Cleveland, so I spent before surgery, even like not really was thought of, but like as we were trying to get in motion, um, I had to spend my entire pre-op up there for an entire week. So I was having blood tests done, like allergy testing done, and like different MRIs pretty much every day for a week straight up there. So I stayed up at the Ronald McDonald House. And then like during surgery and like after surgery, I'm pretty sure I was in surgery for about 4 or 5 hours. So, and then after that, I stayed there for a week again. And they basically told me like pain wise, I was gonna be in pain, obviously.
Mm-hmm.
Um, but um, they kept it well under control. And I think I got released like a day early,
Mm-hmm.
but walking and stuff took time to get used to because my center of gravity was all messed up.
Yeah. So, how far do you live from Cleveland Clinic?
I live about 4 hours. So I live
Right.
in the northern panhandle of West Virginia. So it's
Okay.
about a 4 hour drive.
Okay. So, every time you have to go get a checkup, does it have to be there, or do they have someone here that they're affiliated with?
I go there now because here we just like thought we really like didn't feel like we just felt kind of uncomfortable because a lot of the research and stuff that they would get were like I mean, my cardiologist really did try here, but like at the same time, we wanted someone like that knew the syndrome and knew what they were dealing with. So
Yeah.
we kind of were like, let's just go up. Like we'll take the drive. I mean,
Yeah.
it's worth it.
Yeah. I mean, we don't even have a Marfan specialist in the state. So
Yeah.
that, yeah, I wouldn't have anything like that done here either. So I think that was a
Yeah.
good choice. Um, so when I was reading about it, it said that you could have one bar or multiple bars. Which one did you
Yeah.
get?
I have multiple bars, so I have two titanium rods in my chest.
Hmm.
They chose titanium because if we just went with like regular metal, I wouldn't be able to have my yearly MRIs for my heart and
Hmm.
my like thoracic cavity to be checked up on. So
Hmm.
normally, if you're going in to get it, and you have Marfan and you get your MRIs done, they'll probably choose titanium.
Interesting. Does that does that affect where they place it too?
No, I don't think so. It's kind of more where they place it is like where like the depth and stuff is, where
Hmm.
like where it gets really deep or where it's like a little bit shallower.
Okay. Is it noose? Is that how you say it?
Nuss.
Nuss. Okay. Yeah, see, I'm not saying any of that stuff right. But so, in case they're not familiar with that, so you put a bar in, and from what I'm understanding, from what I've read, it's taking that hole and pushing it out, right?
Yeah, they
So,
take a U-shaped bar and they make two incision they make an incision on your right side and an incision on your left side, depending on like how many bars you have. Like I have 5 totals or 7 total scars from the surgery. But
wow,
if they're only doing one, they'll do one on your right side and one on your left, and they'll maneuver this U-shaped bar through your chest cavity underneath your sternum, and then they'll flip it out. So it pushes it all out.
wow. So,
hmm
what were the other scars from? Chest tubes or something?
Uh, yes. One of them is from a chest tube. 4 of them are from the actual bars, and then 2 of them are on the front of my chest from the retractor because mine was so deep they had to pull it out like with a retractor first and then maneuver the bars under.
Wow. Okay. So, wow. That's not super common, I'm guessing.
No, not really. They normally only use a retractor like when it's a certain depth. I'm not really sure what it is, but
Mhm.
if there's like not enough space to actually fit the bar underneath.
Okay. So, it said that you could have it as an adult, but I mean,
hmm
I don't figure that it would work as well because you're fully developed and your bones are thicker and harder. Is
Yeah,
that what they're
the
telling you?
basically they kind of just told me it would hurt a lot worse as an adult because your like bones are fully developed and everything else, so and healing time would take a lot longer.
Okay. So, what was your healing time like?
Um, so I had the surgery done on November 9th and I stayed in the hospital for a week. I was out of school until the following, like until we came back from winter break. So I was really only out from November to December, but I was just recently like fully cleared after my 8th month checkup, I think it was. I was fully cleared for everything.
So, from that time period where you weren't cleared, did you have to like wear a brace or anything protection wise?
Um, I didn't because I didn't really like I wasn't allowed to move my arms past like here, so I couldn't lift them above my head or anything. So I was really limited on what I could do and couldn't do to begin with. In the car though, I did put a pillow in front of my chest between me and the seatbelt, so if we were to get in an accident, that it wouldn't like fully press against me.
Mhm.
And I always carried a pillow with me to brace myself for like sneezing and coughing.
Oh, wow. Is that something you still have to do?
No. Yeah.
So, how were
Mostly if
you
I
able
just
to wash your hair?
my mom helped me actually. I pretty much cut out off like 8 inches before surgery and then I had my mom help me with it afterwards.
Because I was gonna say, even when I had a pick line and I had like, I don't
hmm
know if you where you can see, it was like right here. I had to put saran wrap all around it, and I couldn't move my arm. So I'm like over here like trying to do this number.
Yeah.
Yeah, it's a
Yeah,
mess.
I showered with a showered chair for a really long time, just like not being able to like stand up and like hold my own weight for a while. Like it was just kind of
Right.
one of those things.
So incision wise, I'm assuming it's just like any other surgery. Once you get the steri strips and everything off, then you can probably shower.
Yeah, actually, they didn't use like gauze or like tape to block my incisions, and I didn't have like stitches or staples either. They used this type of glue. It kind of looked like hot glue on the side of my chest, and they like glued over it. And then once they were like pretty much healed, I was able to take that glue off, or I just had to let it fall off on its own. But I think they did internal stitching,
Yeah.
so
Well, they
I
would
didn't
have
really
to
have
hold
to.
the bar in place somehow. So I'm
Yeah,
wondering,
there are there are stabilizers on both sides of my chest, and it prevents the bars from flipping. So basically, they're kind of just like they're stabilized.
So are they like tied to your ribs or anything?
No, they're underneath them.
Huh. So you set off every metal detector, right?
No, actually, because they use titanium instead of the metal, like
Uh-huh.
instead of like a real metal. Um, I don't set anything off, and I was worried about that too, because that was like one of like the things like when we were thinking about going to conference this year was, oh my God, am I gonna have to get like a pass go card? Like, am I gonna be able to go?
Yeah. Well, I
Yeah.
know for my implants, they gave me, I don't know where they're at, but my lens implants, they gave me cards that said, that I had this implant, blah, 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 blah. And at the time, I was 15 when I got them in the first time, and I had no idea what the purpose of that was, which is probably why I've lost them. But now, um, have you had eye surgeries at all?
I haven't. My lenses are basically they're just a little bit squishy, so we're
Okay.
good.
Well, if once your lenses start moving, and especially if you have fake lenses or no lenses at all, you get this
Hmm.
like it's called iridodenesis, and then they shake like this, right? So the DUI, one of the DUI tests is that they shine this light in your eyes, and apparently when you're drunk, your eyes do this. So I was told years after that, they were like, you might want to find that card because they're probably going to arrest you. And I'm like, what? Like, yeah. So, if did they give you any type of card like that?
They didn't.
They
We
didn't. You might.
basically, if I need one though, they'll give it to me.
I
They're
mean,
pretty good about that kind of stuff.
you might find out like in years. I think it was probably almost 10 years later before I figured that out, and I'm like, wow, like
Oh my
that's
God.
kind of important. Of course, I still don't have it, so I'd probably still get arrested if I was driving. Um, so your follow up, you were in the
Hmm.
hospital for a week. You
Hmm.
came home. When did you have to go back?
Um, basically, it's an every 3 month kind of thing. But I did a 1 month post-op. I did a 3 month. I did a 6 month, and I'll go back for a year. Like I'll do a year.
And then it's every year after that?
I think so. It's either every year or every other year. I'm not completely sure. But I'll have the
Okay.
bars in for 4 years. I'll get them out before my senior year. I'm going into my sophomore.
Wow. So I'm assuming that when they take them out, they're hoping that that will have stabilized during growth and stay there.
Yeah. There are faulties though. There is like a very, very small percentage that my chest can go back, but they're hoping that 4 years with 2 bars is enough and my muscles and my connective tissue and everything will be grown back over so that they can take them out and I won't have any issues and it'll look flawless. But there is always like right now I kind of have a little bit of the pectus carneum because they did push it out, but when they take them out, it does sink back a little bit.
Mm-hmm.
So they did push it out a little bit extra.
Okay. So, in the event that you need more, is it going to be like a sudden thing or does it just gradually go back?
Um, I'm not fully sure. They didn't really educate us on that. It was just kind of like when we get there, we'll see what we do.
Yeah. Yeah. Well, because I know like my stitches are breaking with my lenses, and
Hmm.
typically in a normal environment when your genetic stitches, let's call them your zonules, start to break, it's more of a
Hmm.
slow process until it's really bad. And when my stitches break, it's just gonna be like a bam, like I can't see at all, nothing, no color, anything but
Oh,
color and light. I'm like, okay. So I'm curious, like, what all things snap like that? Do you know what I mean?
yeah.
Like that would
Um,
be probably very, very painful, I would think.
oh, yeah. I mean, I don't really know. I think it would be more of a gradual thing,
Hmm.
just because it was more of a gradual thing while I was growing.
Hmm.
So that's how I would take it.
Yeah. And it said that you could have smaller or larger incisions. Did they tell you which ones you had?
Um, I don't think so. I mean, I think they're all the same. Like the bars would all be the same. Basically, the only thing that they really measure the bars out to be is the curvature of like your chest cavity. So they just kind of took like a 3D X-ray of my chest and built the bars off of that. So I don't think that would mess with like the bar's thickness or anything.
Interesting. Okay. Um, well, some of the stuff that I was reading, they call it funnel chest. But did you
Mhm.
know that they refer to it as being common?
I have heard that it is kind of like it's not a completely common thing, like not like everybody has it, but it's very common in Marfan and it can be common outside of Marfan, but I
Right.
have yet to meet anybody who doesn't have Marfan that has it, so
Right. Exactly. And
yeah.
and I looked it up not in the context of Marfan. I just looked it up like what's Google going to tell me, like WebMD,
Yeah.
And it said common and I'm like, well that's different. And then the stuff
Yeah.
that it said that it was associated with was obviously Marfan was first, and then
Mhm.
Ehlers-Danlos, osteogenesis imperfecta, basically like your bones break easy and that would
Yeah.
happen. Then there's one called Noonan syndrome. You have deformities. Basically, it just grows weird.
Mhm.
Um, and then Turner syndrome, something about like females are born with all X chromosomes, so it does something to your no other tissue disorders, basically. So
Oh wow.
for it to be common, that's I don't know, like all of those things are very rare, and then you're calling it common,
Yeah.
you know. So in the
Yeah,
general
definitely.
public that doesn't have these things,
Mhm.
I mean, I find that really weird.
Yeah, like how common can it be?
Yeah, yeah, I've never seen anybody else with it. I mean, granted, I don't
Yeah.
go around telling people, "Hey, can you take your shirt off? I want to see your chest," you know.
Yeah.
But it also told me that it says treatment helps, but that it can't be cured.
I don't think I've ever heard. Yeah, 'cause I don't know how accurate that is because I mean, I've pretty much gone back to like having a normal chest.
Zoe,
Like,
yeah,
so I don't know how true that can be.
yeah. Well, that's why I wrote this stuff down because um, I'm like, okay, let's debunk these. Basically, they're just
Yeah.
myths. What it sounds like.
Yeah.
Now, one thing it did say that you've already touched on is it worsens with growth spurts.
Yeah.
Um, and it says it's more common in boys than it is in females. I don't know
Um,
if that has
I'm
something
pretty
to
sure
do.
that, yeah, I'm pretty sure that's a big old myth.
Yeah,
'Cause,
I'm wondering if maybe ours just isn't as noticeable because we have breasts.
yeah. I think that is one of like the causes,
Uh-huh.
but yeah, pretty sure that one's a big old myth because I've I personally like just in like the Marfan community have like heard of more girls having it than the boys, but like I'm not saying like one gender has it more than the other. I think it's just kind of a faulty thing with
Yeah.
just yeah.
Well, I actually had a doctor tell me one day that it was actually when I was in the hospital. I had sepsis after my hip surgeries. He comes in
Mhm.
and he's like, "So it says you have Marfan syndrome, so you're related to Abraham Lincoln." And I'm like, "Sure." And he's like, "But I don't think you have it because basically only guys have that." And I'm like, "What?
No.
Where did you get that one? I've never heard that one, but okay,
Yeah,
whatever you say."
yeah.
um, so what else do I have here? Um, what after you got cleared? What are your limitations now and your modifications and stuff?
Um, do you want like the whole like story of like what they were or just like
Sure,
now?
sure.
Okay, basically up until like the 3 month period, I wasn't able to lift my arms above like shoulder height. and bending down was kind of a rough patch. I had to do like small stretches just to make sure like things weren't getting like really really tight or anything. So I would just lift my arms up like really gently every day. Um, I had to do breathing treatments so I could get like fluid out of my lungs. Um, Bathing was an issue too. Like I wasn't able to take baths and I had to either have assistance or shower in a shower chair for about 3 months
Yeah.
after surgery. And then now I'm at the 8th month period and I've been cleared for everything at this point.
Hmm.
So I'm able to lift my arms up both at a time. Basically, the only things that I really have to watch out for are hard blows to the chest now.
Okay. Well, because I know, impact sports are kind of off limits anyways for
Oh
a
yeah.
Marfan patient. But
Yeah.
is it like even more strict now, I'm assuming?
Um, Not completely. Basically, I'm just not allowed to do everything that I wasn't able to do before. So basically, I'm back to like square one where I'm not
Yeah.
allowed to like play basketball or volleyball or anything like that.
So now you're just a Marf again.
Yeah.
Well, that's really not that bad because I envisioned like a lot of um like roller coasters and things like that. I know we're not technically supposed to go on
Yeah.
those, but it seems like that would be way off limits now.
Um, I don't think so. Like basically, like I said, I just have to watch out for like hard impacts to my chest. And it's more of just like an ow, that's really gonna hurt if it happens kind of thing. It's not like because the stabilizers are there to keep it in place, like keep them in place so they don't flip. But of course, like if I get hit hard enough, there is a small chance that they could flip.
Interesting. Now, were you with just your Marfans in general, were you spontaneous mutation or genetic?
Spontaneous.
Spontaneous. Okay. So there wasn't any history then, because that was going to be my next question. If whoever had it also had the pectus deformity.
Yeah, no, I was pretty spontaneous. We can't really trace it back that far, like if it might have skipped generations or anything, because my grandma on my dad's side was adopted, so there's really not a way to identify, like, really trace it back. But normally, if anyone else were to have it in my family, it would either be my dad or my mom,
Right.
and
Right.
none of them have any of the traits, so we're
Hmm.
kind of just at a blank stage.
Yeah. My mom has it, but she's very minimal. Like I can
Yeah.
probably count all of hers on one hand. And it's like it
Wow.
just hit me with a wrecking ball. And I'm like, thanks. I might as well be a mutation because you have
Yeah.
like very little.
Yeah.
So, I think that's all of my questions. Is there something that I've not touched on that you can think of?
Um, I don't think so. It was more just like the recovery process, maybe. Um, it was pretty rough. There are some like crazy stories that like I was in the hospital and I was allergic to one of the medicines that they gave me, so they like switched it and then it blocked all my pain receptors, like all my narcotic receptors.
Uh huh.
So it like switched everything and off pain meds, I would not recommend it at all. If you're gonna refuse the pain meds and do the surgery, would not recommend that.
That sounds brutal.
Yeah, it was really bad. So if you're gonna have this surgery and try to like not take the pain meds that they give you, I would not recommend that at all.
Did they give you a bunch of antibiotics as well, or no?
Um, Not really. It was more just constant drips of Dilaudid and just other pain medications to kind of help everything go a lot smoother.
Yeah. Well, because realistically, it's not a very open procedure, but they are inserting foreign body. So,
Yeah, they say it's not an invasive procedure, but it's pretty invasive if you think about it.
yeah, they're adding a basically something bigger than most of your organs into your body.
Yeah.
Like I feel like that's pretty invasive.
Yeah. They
Uh,
say I think they call it a minimally invasive procedure.
I mean, when I hear that, I think of like colonoscopy, but whatever.
Yeah,
Huh.
they can give it their own names.
Yeah. So, what else, how else has Marfan's affected you?
Um, Mostly, just as like a kid and like an adolescent, it's more of just like not being able to fit in like to other places. So it's more been like a mental challenge and kind of a mental barrier, but also at the same time, obviously there have been physical barriers to jump.
Yeah. So, yeah, I know you said your lenses or nothing like that was affected. Um,
Mhm.
like, do you have the extremely long fingers and all of that?
Yep.
Yep. And your toes too, or no?
Yeah.
Yeah.
Um, Basically, I have pretty much all the physical features.
Uh-huh.
When I was younger, the facial features were more apparent, but as I got older, my face started filling out a lot more.
Uh-huh.
I have like a lot of like the um joint issues and like the TMJ and everything like that, and obviously like the cardiac issues. But some things are more minimal than others.
Now, are you dilated or do you have a murmur or what's going on with your heart?
Dilated, murmur, and MVP.
Okay. That's pretty much what mine is too. I think that's like the main ones that we have.
Yeah. Um, yeah, I'm pretty sure I haven't heard of any other ones that really are apparent.
No, I think there was another a prolapse one or something like the MVP, but I don't
Yeah,
remember
my
what
true
it is.
prolapse.
I don't remember what the other one was though. So obviously it's not too horribly bad.
Yeah.
So, but I was reading though that it said that the deeper that your hole or bowl or whatever you want to call it gets, then it can like worsen your murmur and things too.
Um, I'm not 100% sure on that. I know, like, um, when I was younger, my murmur was more apparent, and it's kind of like mellowed out as I've gotten older.
Hmm.
Um, and so it's like they call it like the click with my mitral prolapse. Like my click has kind of gotten a lot quieter.
Yeah. Huh. Mine, well, my heart rate in general, like when they do my blood pressure, you can barely hear
Mhm.
it. So
Mhm.
only my cardiologist tells me that I have a murmur, and everybody else is like, no, you don't. I'm like, I feel like he's the cardiologist, so I think I
That's
probably
like a
do.
human.
No big deal. But okay,
Yeah.
well, if you can't think of anything else in here that I've not touched on, I will let you go and let you enjoy the rest of your evening because you just got back today, didn't you?
Um,
Or was
I
that
got back yes. Yeah, I got back early yesterday. I've
Oh,
kind
okay.
of been sleeping a lot.